with Choice Health Formulas. I'm Brent Taylor. What is insomnia? If you find yourself laying around in the middle of the night, awake, unable to sleep, and asking yourself, do I have insomnia? You probably have insomnia. Insomnia isn't just when somebody cannot go to sleep. It's when they have intermittent sleep or just really bad sleep to where their brain isn't going into deep enough cycles to recover and feel well the next day. But it can definitely be not sleeping at all. More commonly with my clients, they come in and they say, if I get to bed by 10, I sleep really good from about 10 until 1 or 10 until 3. If they go to bed or a little later than that, they still wake up at 10 or 3. Why is this causing insomnia? There are many factors to insomnia: stress-induced, metabolic, meaning the way your body's functioning, either nervous system or blood sugars, and then nutritional, which we'll cover those in more depth in a later video. But right now, going over what is insomnia and how is it diagnosed. So diagnosis of insomnia, first thing you would do is eliminate the things that may be presenting as insomnia but are not. So for example, sleep apnea, where you're not breathing well at night, your oxygen's dipping low. Maybe you are breathing, but your oxygen's dropping low, and then your body's waking up and it's saying something's wrong, you need to move, you need to breathe. And that is often a contributor to insomnia, is either sleep apnea or low oxygen. Another thing that can cause low oxygen, but not necessarily sleep apnea, is mouth breathing at night. So there are some things you can do for that. They actually have mouth tape, and what it does is it holds your upper lip and your lower lip together while you sleep. There are some that cover your whole mouth. This is not recommended for children. It's only for adults. I don't like to cover my whole mouth when using mouth breathing tape. I use a strip that is just about as wide as my nose, but then lets me breathe through the corner of my mouth. The idea is that your lips stay closed together for the majority of your sleeping. And then in the middle of the night, if that mouth tape is bothering you, or if you wake up and feel claustrophobic, you can stick your finger in the corner of your mouth and just pull that tape off real quick. But again, it's not recommended for children, as if they get sick and then throw up, we don't want them aspirating on their throw up. Allergies can be another factor, as it causes you to not be able to breathe well through your nose and your mouth at night. And so, maybe allergy treatment is appropriate, or maybe it's seasonal allergies or a dust allergy. So sticking air purifier by the side of your bed to clean up the air that you're breathing in the night. That helps you remain more open and clear in your breathing. And I've had that work really well for a large handful of clients. Snoring, it could be your own snoring. That goes back to a sleeping airway issue for you usually, but then your spouse. So if your spouse is snoring, maybe you need to get them some breathe right strips or some nasal dilators, or help them with the mouth breathing, or get some pajamas with the ball in the back so that they're not laying on their back and they're laying on their side. There's lots of different things you can do along with both the snoring and the allergy relief. If there's a lot of sinus related issues, you can put sinus spray called Xlear sinus spray up each nostril before bed. That helps open up and tone the membranes, so there's less snoring, and again, it helps with allergies. So eliminating those can make a huge difference in your sleep, and that needs to happen before diagnosis of sleep apnea. Going back to high stress, your brain just doesn't want to shut down. That high stress is kicking in your adrenal glands, and those adrenal glands are just pumping out the cortisol at night, and you're not sleeping. You may have a prostate issue. Maybe that you're just getting up and going to the bathroom 2-3 times a night. And that can be addressed. If we can improve the prostate health, then you're not going to the bathroom so much at night and you sleep better. So those are things that may need to be tackled first. There's not an all one and done necessarily with insomnia if it's multifaceted. Check out our next video on what foods you should be avoiding or using around bedtime so that you can sleep better.